Hi, everybody. It's Kevin and Donna from the Deprescribing Show. Really excited for a great episode this week. This one is on OTCs and what are you treating? So, really trying to tie everything together. This episode, if you haven't read the MedStrong book, sponsored by MedStrong. And so, go and grab your copy here soon. I'm going to play this ticker here, Donna, and we will get right into it. All right, everybody. Donna said right off the bat she was going to put me on the spot. So I'm a little nervous. I think I'm ready.
So OTCs, right, Kevin? We were just saying how problematic they can be, and but they can be very helpful too, as we know. But a number of years ago, I had gotten a call, and I'm going to tell you the story in a minute. But what I want to ask you as a pharmacist, if you're getting over-the-counter OTC aspirin, low dose, what are the instructions on the label, on the manufacturer label?
I have no idea what the instructions
Yeah.
are on the manufacturer label.
Yeah.
Other than we're not supposed to call them baby aspirin anymore. I know that.
Low dose, right? So
Right.
so what it is, 4 to 8 tablets every 4 to 6 hours as needed.
I thought it might
Okay?
be the treatment route as opposed to the
Yeah,
cardiovascular. Yeah.
exactly. And nowhere on there is there any instruction of how to take it for cardiovascular protection. So I got a call some time ago, and this is what I just want to share with everybody and how important it is that we really dig and ask questions and not just assume that people are doing what they're supposed to be doing. So I got a call. This woman was going through her medicines, and she was calling the outreach program that I worked at in order to say, you know what, I'm having difficulty affording some of my medicines. And I was like, okay, so I'm going through, I'm taking her intake, and she says, she tells me that she takes aspirin every day. I was like, okay, added that to the list of other ones. And she goes on to say, I'm really having difficulty affording my aspirin. And I was like, really? Tell me more. How are you taking it? Right? That's you can't just breeze over these things. How are
Assuming.
you taking it? Oh, I'm taking it just as it says. I take 4 tablets every um every 6 hours every day. I'm like, "Oh my gosh." She goes, "My doctor told me to take aspirin every day, low dose aspirin every day." I was like, "Wow." So she was taking 16 tablets every day, and it was getting expensive. Well, yeah. Yeah, it would.
Yeah.
So,
Especially for your GI tract too.
yeah, and so I said, "Okay," and I just said, "Before I go on," I said, "Can you just tell me, are you having any gum bleeds? Are you at nosebleeds, bruising, anything out of the ordinary?" She goes, "No, no." I was like, "Okay." I said, "Really, I think that your doctor probably only wanted you to take 1 tablet once a day." And she said, "Oh my gosh, I'm like the conversation ensued, and she says, "I am so embarrassed right now." I'm like, "Why?" I go, "You did your due diligence. You were told to take aspirin every day. And we
Yep.
can't all assume that everybody knows to take 1 low dose aspirin once every day if that's what their doctor is prescribing for them."
So true.
So lots of confusion, lots of issues. And not only was it going to probably cause havoc eventually for this poor woman, but the expense, right? And so when we're talking about OTCs and we're talking about all those supplements and herbals and things that people just love to spend money on, it can really be um, very expensive for people. And I hear it so often from folks. So that is my opening story on how important it is that we need to make certain that people are taking OTCs as they should, that they're appropriate for them. And we know now aspirin, they're blowing that up again. So I've been doing a lot of med reviews, and there's a lot of folks taking aspirin every day, and it really isn't necessary according to newest guidelines. So much
I
to
love
talk
the
about in this section.
controversial one right off the bat, Donna. With aspirin. I was thinking you do like what Kevin usually does with students, and I bring up fiber because I go, "How do you take fiber?" And then everybody assumes it, and then I tell them, "Do you know how many people I've seen in the hospital that took their fiber the right way and now have bowel impaction going on or other problems
Oh,
like that.
yeah.
So those things, but aspirin, like we don't
Yeah.
have to get into the nitty-gritty details, but that is an interesting one because it comes up so often, Donna, of
Right.
some of the data out there to do every other day with some bleeding patients that I've had, and then also
Mhm.
with patients that have never had a cardiovascular event before, but we're always taking it because there is an apple you take a day to keep the doctor away, and there's an
Yeah.
aspirin you keep it.
Yes, you're right, for sure. So just really interesting,
Really?
but a great starting conversation for people because we see it all the time.
Yes.
And what is the need? So yeah, you had an interesting slide for us, Kevin.
Yeah, I just want to pull it
So
up just to show everybody, Donna. Just this is a breakdown, and this is from a website here we can leave in the description, but is in millions of dollars of over-the-counter products in the United States in 2020, like what we would kind of expect. And as you can see, like the plethora of vitamins available is pretty massive. But as we go down from cold and allergy and
Mhm.
sinus tablets and internal analgesics and weight control, gastrointestinal tablets, like all of those things really start ticking off in our
Mhm.
mind. We realize that some of these things, even though it's correlated to cost, we can look at it as number of individuals that can also be taking it. And these are so common to see on an individual profile, or that I'm sure Donald will attest to, not to see on the profile, but then have to ask a patient about, and they end up going on the profile.
Yeah, absolutely. So when we're looking at those, and thinking about the cost too, it's really something I have to, when what I really want to get across, and I just think it's so important when people are telling you about the OTCs and the supplements that they're using and herbals. You need to know why. Why do you think you're taking these?
Mhm.
And they're probably treating something that's a side effect more times than not. And or they think that they're doing something good for themselves, but it it might not have the ramifications that they think.
Yeah.
So I'll share with you one other story just because I saw the vitamins, but if we're thinking about herbals too, there was a woman that we were reviewing, and she was in the hospital. She had had a stroke, and her husband had said, "Could you take a look at these OTCs that she's been taking?" And I was like, "Yeah, sure, of course we will." 3 OTCs that equaled 33 herbals that she was taking because they were multiple combinations of products.
Yeah.
And when we were looking at these and looking at what was in these herbals, and then looking at potential side effects and issues, things that I've seen throughout all of my years of looking at herbals and looking up things for folks, and not that they're bad for everybody. Like some people, they work great, but this particular case caused havoc with her blood pressure, which she was already on blood pressure medications, and probably contributed to her having a cardiovascular event of a stroke.
Yeah.
And so that was one thing. But what else I've seen as issues is increased risk of bleeding for a lot of folks with various herbals and supplements. Um, and then things that cause havoc with diabetes and blood sugar levels. That's another area that tends to be problematic for folks. And then also hormones. So when you're thinking about like estrogens for women and things such as that, they can cause a lot of issues as well. So when we're looking at our herbals and anything over the counter, what are they doing to this homeostasis, if you will, of our bodies and what we're trying to treat, or what's going on, what's happening, and what could cause us to end up in the hospital. So we want to make certain that we are checking these things, that when people are in the hospital, what OTCs are you taking? I've seen kidneys in trouble because of NSAIDs, for example. People didn't even realize that they were causing problems for their kidneys. So we're going to go on and on about all of these things. I'm not going to get into them right now, but once people go over to my channel, they'll get to learn more, and they'll also see an amazing thing about some of the labels of over the counters that I can't wait to share.
Oh, awesome. Okay. Well, for everybody, to so you guys know, every time that we do one of these episodes on Donna's channel inside of RPH Ally, I put there's an unlisted or a private YouTube that Donna and I do live. And so you guys can join us right there, ask questions through RPH Ally, ask it on our YouTube channel, and we'll get to jump into more details on OTCs, because I tell you what, it is the forgotten problem across of all of America until it isn't forgotten. And we have issues like Tylenol pop up out of nowhere, right, Donna? So we'll see you guys over there. Excited to be able to continue the conversation, and we'll talk to you soon.
Bye, everybody.